This vaccine, the mRNA vaccine for the COVID-19, is one of the most elegant and safest vaccines we've ever had developed. I would put it on the same safety profile as many medicines we take on a daily basis: ibuprofen, aspirin, Tylenol. It was designed without a live virus. You are not getting a live virus. This vaccine teaches you how to make the defenses against the virus. So your own immune system is the one fighting the virus, and that's the nature and the purpose of the vaccine. So what we know so far about the vaccine is that it is very effective of keeping people out of the hospital and keeping people from getting sick enough to require ICU beds, ventilation, and even death, opposed to the unvaccinated, which we know at this point it's ravaging. If you have the vaccine, we know that you have a significantly greater chance of surviving, doing much better, and staying out of the hospital. So if you've had COVID, you are going to have an immune response and you will have some protection. But the problem comes, is it enough protection? And the vaccine not only can double or triple, but even 6 to 10 times the amount of response it helps your body build by making antibodies, which are what attack the virus. One of the hardest diseases we've had to treat in mankind are viruses. We seem to have figured out bacteria, parasites, even have done pretty well in oncology, which is cancer. But viruses, we have very few treatments that can actually treat and attack a virus. So we have to rely on the human body by triggering it and teaching it with a vaccine to do that. The human body is by far the most effective way to get rid of a virus. So the vaccine is critical in teaching your body how to eliminate the COVID-19 virus. So the way the mRNA vaccine works, it has nothing to do with your DNA. It's an instruction book. It actually teaches your cell how to make a protein that then triggers your immune response. That is all it can do. And after 24 hours, that instruction book, like in Mission Impossible, is gone. So it has nothing to do with your DNA. It is simply an instruction book for your cell to make a certain protein that just looks enough like COVID, where your immune response will kick in, learn how to fight it, so that if you are exposed to the real COVID-19, you already have the playbook. When the vaccine came out, I immediately received my dose in December and January, the 2-shot. My wife then followed in early March when it was approved for adults, and then my 19, 17, and 14-year-old as soon as they were eligible. And I have 3 under the age of 12, and the day that it comes out, we'll be in line to get it, because I feel that strongly that the only way to protect my family and all of the families I care about, especially in the Acadiana community, is if we all teach our bodies how to fight the virus, and that can only be done with a vaccine.